Hello everyone and welcome. Today we're diving into a lesser-known but potentially serious condition affecting the urinary system, ephedrine stones. We'll explore what they are, what causes them, and how they're managed. So let's get started! The primary culprit behind ephedrine stones is, unsurprisingly, ephedrine. This stimulant, found in some over-the-counter medications, weight loss supplements, and formerly in some decongestants, can lead to crystal formation in the urine under certain conditions. Excessive use, particularly at high doses or over prolonged periods, dramatically increases the risk. Dehydration, which concentrates the urine, also contributes significantly to the formation process. Underlying metabolic abnormalities or co-ingestion of other substances that alter urine pH can further exacerbate the problem. Now, let's talk about how these stones form. When ephedrine is ingested, it's metabolized and excreted by the kidneys. If the concentration of ephedrine in the urine becomes too high and the urine pH isn't ideal, ephedrine can precipitate out of solution and form crystals. These crystals can then aggregate over time, binding to other substances in the urine like calcium oxalate, uric acid, or other medications, gradually growing into larger stones. These stones then lodge themselves within the urinary tract, causing obstruction and inflammation. Epidemiologically speaking, ephedrine stones are relatively rare compared to other types of kidney stones like calcium oxalate or uric acid stones. However, their prevalence has fluctuated over time in accordance with ephedrine use patterns. Times when ephedrine-containing products were readily available without prescription saw a higher incidence. Certain populations, such as those who chronically use stimulants or those with underlying kidney issues, are at higher risk. Accurate epidemiological data can be difficult to obtain as ephedrine use, and its regulation varies across different regions and countries. The signs and symptoms of ephedrine stones are often similar to those of other kidney stones. This includes severe sharp pain in the side and back, often radiating to the lower abdomen and groin. This pain, known as renal colic, comes in waves. Other symptoms can include nausea, vomiting, blood in the urines, hematuria, frequent urination, painful urination, dysuria, and urinary urgency. If the stone causes a blockage leading to infection, fever and chills can also occur. Diagnosing Ephe stones typically involves a combination of methods. A thorough medical history including details of medication and supplement use is crucial. Urine analysis can detect the presence of crystals, blood, and infection. Imaging techniques, such as a CT scan of the abdomen and pelvis, are commonly used to visualize the size, location, and number of stones. X-rays may also be used, but ephedrine stones may not always be easily visible on plain X-rays. In some cases, a metabolic evaluation may be performed to rule out underlying metabolic disorders that could contribute to stone formation. While kidney stones in general can be classified by their composition, e.g., calcium oxalate, uric acid, ephedrine stones by definition are primarily composed of ephedrine or its metabolites. They may contain smaller amounts of other substances, making them mixed stones in some instances. However, the defining characteristic is the presence of ephedrine as the main component. Treatment for ephedrine stones depends on their size, location, and the severity of symptoms. Small stones may pass on their own with increased fluid intake and pain medication. Alpha blockers, which relax the muscles in the ureter, can also help facilitate stone passage. Larger stones may require intervention. Extracorporeal shock wave lithotripsy, or ESGL, uses shock waves to break the stone into smaller pieces that can be passed. In more severe cases, procedures like ureteroscopy, where a thin scope is used to visualize and remove the stone, or percutaneous nephrolithotomy, a more invasive surgical procedure, may be necessary. Prevention is key when it comes to ephedrine stones. The most important step is to avoid excessive or prolonged use of ephedrine-containing products. Maintaining adequate hydration is also crucial to dilute the urine and prevent crystal formation. Individuals with a history of kidney stones or those at higher risk should consult with a healthcare professional before taking any medications or supplements containing ephedrine. Monitoring urine pH and, if necessary, taking steps to maintain an optimal pH level can also be beneficial. The prognosis for ephedrine stones is generally good with appropriate treatment. Most stones can be successfully removed or passed, and symptoms can be effectively managed. However, recurrence is possible, especially if the underlying risk factors, such as continued ephedrine use or dehydration, are not addressed. Current research is focusing on refining imaging techniques for better detection of ephedrine stones and developing more targeted therapies. Further investigation into the metabolic pathways of ephedrine and its impact on urinary crystal formation is also ongoing. Thank you for joining me today as we explored the intricacies of ephedrine stones. Remember to always consult with a healthcare professional for personalized medical advice.